Hey guys, welcome back to Medical Coding with Blue. Today we're talking about what happens during a medical coder's audit. Now this was a special request from a viewer and I am here to honor that request. So let's get started. First of all, let's start with the word audit. This is not a word to be scared of when you are a medical coder, okay? It is a fact of life when you are a medical coder that you are going to get audited every month. And usually that's what happens. Maybe not at all facilities, but at most you're going to be audited every single month. And these audits are conducted by either your supervisor, a lead, or somebody in your data quality department. And essentially what they do is they pull a random sample of your records that you've coded, and they look at your codes versus what they would have coded if they were coding that chart. If you are missing any diagnosis, if you are off on your levels for your evaluation and management, if you are not picking up your procedures properly, if you're not applying your modifiers properly, they're going to let you know. And so a good auditor will bring to you their reference of how did they get to that? How did they come to that conclusion? So that's just something that it's just part of it. And it helps you to grow as a coder, that you learn more. You can see what somebody else is seeing, because sometimes when we're looking at stuff, we kind of get tunnel vision, and it's easy to sort of like get stuck in that rut of like, oh, well, I see this, this, and this. And then somebody else comes along as a fresh set of eyes, and you're like, oh, well, wait a minute, there's this, this, and this, and oh, I've never seen this. So now, okay, well, I can just pick this up. So there's that. You do have to strive for high accuracy. And if your auditor is really, concerned about like, why are you missing this or this, they will show you why they were able to get what they got, and then help you to learn not to do it again. But if you continue to do the same thing over and over again, and you're just not learning, or you don't want to apply what they said, because of whatever reason, that's where, you're wrong, because we are there to learn from the auditor. And if you are having an issue with them telling you that you're wrong, that is part of our field. Even I make mistakes, okay? Clearly, I did a video where somebody caught me in my own my own question I had, and it wasn't clear enough, or I selected the wrong code on my own question that I wrote. So, that's just something that it's like, oh, okay, you just got to shake it off and keep going, because I still know what I'm doing, and that doesn't shake me. So don't let it shake you. If you have a bad audit, if they happen to come back with a lot of stuff that was wrong, it's okay. Just take a deep breath and just shake it off, Learn from your mistakes. That is the number one thing that I can say about medical coding audits, is learn from your mistakes. Because they don't want you to keep making the same mistakes. Obviously, they want you to be able to learn, grow, and continue to get better with your with your code selections. Okay, so just be sure to just keep that in mind. And one thing I learned from Arbinger training is that it's not all about me. Okay, if the auditor says that this is wrong or that's wrong, she's not attacking me. It is just literally, maybe I selected something that was wrong, or maybe she saw it, and then I can tell her this is what I see, and then maybe convince her that I'm right, with my resources or whatever. So always be sure to keep those in hand. Keep your resources with you. Especially if you get caught up on a very difficult chart. You want to make sure that if you're using a resource, write it down, email it to yourself, email that resource link to yourself. Sometimes it's an article that I will find online, and I'll just email it to myself, so that way if I do get audited for that particular record, I can always pull it out and say, well, this is where I cited my reference from. Okay. And make sure if you're citing references that you're citing them from credible sources, not some random, website or something. You want it to have some sort of credibility to it. I'm sorry, my phone my watch keeps buzzing me. But yes, so, just keep those things in mind when you are getting audited, but it is not anything to be afraid of. And don't let the audits get in your head. If you have a 1 month that was really bad, Don't let it get in your head. Don't let it shake you. You still know what you're doing. You still passed your certification exam, right? If you have your credential. So, just keep that in mind. You know what you're doing, and also, if on the other foot, if you do really well, don't let it go to your head, because you may have one good month and then the next month it'll come back and bite you. So, just keep that in mind too. Don't get too cocky, and don't show off because you got 100%, because there's going to be some times when you're going to get 100%, I did have one person that audited me that was upset that I got 100% correct, but I'm like, okay, I'm on your team. I'm on your side, but that was I guess a personal issue for her. So, it worked out because I was able to prove my argument. You always want to be able to prove your argument. But like I said, don't be arrogant about it, and don't be gleeful, just be humble. That is the number one thing is, you got to be willing to be a driver and be a passenger at the same time when you're a medical coder. So just words to live by. But yeah, that was my thought for today, was about the audits. I am gonna link the other 2 videos that I had about audits, because essentially I don't want to sound like a broken record, and I don't want my content to get too boring, just talking about the same thing, but audits are a fact of life when you are a medical coder. Don't be afraid of them. They're there to help you and see where areas where you can improve. And even to me, to this day, I'm always willing to see areas of improvement, but sometimes when I see my audits, I'm like, okay, I'm ready to go because I know how I can argue this, and so it is all about striking that good balance of, being respectful and making your point at the same time. Okay, so that's all my thoughts for today. So I'm going to go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, please be sure to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all in the next video. Bye.